I'm Renda, a board-certified OBGYN, and I'm also Rachel's mom.
That's right. So this, um, I'm sorry. On our next episode next week, we hope that
Yes,
we'll be
next
able
week.
to record together. Yeah,
Right. Yeah, because Rachel's coming to Alaska to visit us. Rachel's youngest sister, Emily, is getting
Emily.
married. Yeah, we're going to be
Yay.
having a family wedding. So that means I'm going to get to see JJ.
That's right. I'm bringing JJ, and I'm so excited to get to see you all and to be there for Emily's special day. I'm so excited for Emmy. But I'm not that excited about traveling with a newborn or a 4-month-old.
Uh,
Maybe after this trip, I'll do an episode all about traveling with a newborn and what not to do, because I'm sure I'm going to make all the mistakes and I'll tell you, don't do this. But the flight is 5 hours with a 4-month-old,
uh,
and then I have to drive 4 hours. So
right.
we'll see how it
So
goes.
I think that's a great idea. We should definitely do an episode on what not to do.
Yeah.
Now, I also want to say that today I'm super excited about the episode we're recording today because
Yep.
in this episode, we're continuing on talking about routine prenatal tests that are typically done after the first trimester. So, in the
Yeah.
last episode, we discussed first trimester tests, and this time we're going to cover more routine testing so that moms are going to be able to better understand what tests we're recommending and why we offer them and what the results mean.
Exactly. In the last episode, we went over all the tests that are routinely done at the first prenatal visit. There is one other test that is sometimes done in the first trimester, but usually after 11 weeks gestation. And the last thing that we do in the first trimester is genetic screening.
Right.
Most patients these days have non-invasive prenatal testing, NIPT, in the first trimester. Some people refer to it as the gender test, but that's
Right.
actually not the only thing that it's for. It takes a sample of your blood and separates out the fetal fraction and analyzes the DNA, and it tests for the 3 most common chromosomal disorders. So there is trisomy 21, because you have an extra chromosome 21, trisomy meaning 3. Everyone has 2 copies. These people have 3. So trisomy 21 is a extra chromosome 21, and that's Down syndrome. Trisomy 18, which is an extra chromosome 18, and trisomy 13, which is an extra chromosome 13. And, as I said, it can also tell you the sex of the baby.
Right. And depending on which NIPT your provider offers, the test may screen for other genetic disorders as well. So it can test a lot of different genetic problems, but it does not test for all chromosomal or genetic disorders. It also does not test for any structural problems like heart defects. And it is just a screening test, meaning positive results suggest that this disorder is present, but they cannot tell you with 100% certainty if the disorder is truly there. Although it's rare, there can be false positive results. Now, that's pretty rare, but it can happen. So, in order to know for sure, generally other testing like an amniocentesis might be required to definitively diagnose a chromosomal problem. An amniocentesis is where we put in a needle into through the mom's abdomen into the bag of water around the baby and draw off cells from the amniotic fluid. And that's going to be a test to let us know for sure what the baby's chromosomes are. But there's something a little better than that, and that's called chorionic villus sampling, or CVS. And that's where we take a little piece of the placenta for analysis. But there can be genetic mosaicism in the placenta, and that's just a fancy way of saying that the genetics in the placenta can be a little bit mixed up, for lack of a better way to put it. But
Mhm.
amniocentesis and CVS are definitive because they're going to be only the baby's cells. So they're going to give you that definitive answer. But most people in that first trimester are going to have the NIPT done. And most people won't have to worry about an amniocentesis or CVS. So both the amniocentesis and the CVS carry a risk of pregnancy loss. Just doing those tests can cause a woman to miscarry. And that's a significant problem, right? Now, of course, NIPT does not have that risk. It's just a blood draw. And if you're pregnant, you're likely going to be having several blood draws throughout your pregnancy.
Just a
And it,
few.
yeah, and it is really actually quite accurate, especially when compared to the older tests that were available when I was having babies. Those tests had pretty high false positive rates. So this test, it's pretty accurate.
Yeah, so the NIPT is also the test that can check a baby's blood type, like we talked
Right,
about last week. And that is how we decide if ROGAM is needed.
right. But not every NIPT test can offer this. So check with your provider to see which one they offer.
Gotcha. Okay, so what are some reasons a person might want to get this genetic testing versus opting out of the genetic testing?
Yeah. So, I mean, it's certainly always a mom's right to opt out of certain testing. This test used to be real expensive. So now it's covered by most insurances. It's considered a standard test and recommended for all pregnant women. So the expense really should not be a deterrent to getting the test done. Every pregnant woman expects a perfect baby, and I really wish that were true, but
Yeah.
sometimes it just isn't. And if you do end up having a baby with a problem, I think it's really good to be able to prepare yourself and your family. If your child has Down syndrome, for example, you can educate yourself and get involved in support groups. But I know some people decline the testing because they say it's not going to change anything about what they're going to do, and that the testing may cause extra stress. Plus, they're worried about the test could be false positive, even though it is extremely rare for that to happen. So I practice in a rural setting in a small town, and my hospital does not have an NICU. So we do not have the capability of taking care of a baby who's born with problems. So those babies, if they're born with a problem, they get sent by helicopter or an airplane up to Anchorage. And if we know in advance that a mom is having a baby who may need extra support after delivery, then the mom can deliver her baby up in Anchorage rather than delivering here in Homer, where I live, and then having the baby shipped out, and the mom may or may
Yeah.
not be able to go with the baby, right?
Yeah.
And
Yeah.
if the mom delivers right there where there is a team of pediatric providers ready to provide care for the baby right after birth, that's just so much better. So that's
Yeah.
one of the main reasons that I'm a strong advocate for the test. I never want to be in a situation where we don't have the resources or the expertise to care for a baby in our facility. I just don't want to go there.
Yeah.
So
Of course.
another reason to get the NIPT testing is that this is the most accurate way to tell the baby's gender, right? Because ultrasound can be
Yeah.
incorrect. So when I
Yeah.
was pregnant with Emily, the daughter who's getting married soon, I was in my resident training, right? I was in training, and I did my own ultrasound, and I convinced myself that Emily was a boy. I even named her John. I'm not sure what I saw. I don't know. Maybe it was the umbilical cord between her legs. Who knows? But I told everybody that I was having a boy. I even
Mhm.
started getting gifts like little blue onesies. Well,
Yep.
Emily is very much not a boy. um, she's
No.
not. We didn't have NIPT back then. And fortunately, I figured it out before she was born. I did more ultrasounds on myself and I could never find that part again. So I did figure it out eventually. But you don't want to be wrong about the gender of your baby. I'll just take it from
Yeah,
me.
I remember that. I'm gonna tease her about that this weekend.
I know. Yeah.
We thought
Yeah.
you were a boy.
Yeah. I know. All her
Um,
brothers and sisters thought we were having a boy. Yeah.
but anyways, so the last thing that some patients may want to get at that initial visit or sometime in that first trimester is a diabetes screening.
Right. And this is not the gestational diabetes screening that we're
Right.
talking about.
Right.
Gestational diabetes is defined as diabetes that develops in the third trimester. So, this type of diabetes screening that we do in the first trimester is really looking for undiagnosed or undetected diabetes or glucose intolerance, insulin resistance, difficulty processing blood sugar, and that was present before pregnancy that maybe we just hadn't picked up on yet because, I don't know, maybe the patient hadn't seen their primary care doctor for a while, so it hadn't been tested. So this is really to pick up people who probably had issues with processing glucose before they got pregnant. And people who are at higher risk would include women who are significantly overweight. So if your body mass index or BMI is 30 or more, you're generally we're going to want to do a diabetes screen early to see if maybe you have some diabetes before you even got pregnant. So if you have high blood pressure, that can increase the chances that you also have diabetes that's unrecognized, or maybe you just have difficulty processing blood sugar. Patients with PCOS, polycystic ovarian syndrome, often have insulin resistance, right? So, also, if we see sugar in the urine, that can be a sign of having diabetes that was present before pregnancy. And we're just picking it up in the early part of pregnancy. So, we may recommend screening for diabetes in that first trimester for some patients. Also, some patients, especially those who have not seen a physician for a while, if they're at high risk for other medical problems, might be screened for those. For example, if I find an enlarged thyroid when I do my exam, or if they have a strong family history of thyroid dysfunction, then maybe we'll draw a TSH with their prenatal labs to screen for thyroid disorders. One thing that we do not typically check for in pregnancy is cholesterol. And I often have patients say, just to add that on. But pregnancy can cause changes in your cholesterol. So you don't want to get your cholesterol checked during pregnancy. You want to get it screened either before or after pregnancy, but not during, right?
Gotcha. Gotcha. Okay. So that is most of what's done in the first trimester. Moving moving on to the second trimester, that's between 13 and 28 weeks. The big thing that you're going to get is an anatomy ultrasound. This
Yay.
is, yeah, so fun. This is typically done around 20 weeks and can be done anywhere from 18 to 22 weeks. This is an ultrasound where we want to get comprehensive views of the baby from many different angles. So it typically takes a while, like 30 to 45 minutes. They're going to look at how the baby's growing. They're going to do different measurements of the baby, how much the baby weighs. They're going to look at all the baby's pieces and parts: the face, the mouth, the brain, the spine, the heart, the stomach, the bladder, the kidneys, the sex organs, the limbs, the placenta, the amniotic fluid, everything. They're going to literally look at everything. And at that time, sometimes if that ultrasound machine has the capability to do 3D images, not all offices have a machine that can do that. But if it does, and a lot of them do, you can get 3D images of the baby, which is so fun. An anatomy ultrasound is also really good at seeing potential problems. It doesn't detect all of the problems, but it can detect some of the possible problems that can occur. But it's so fun because for 30 minutes you get to lay there and watch your little baby on the screen. Sometimes it can be hard to get them to move. So eat or drink something really sugary before the ultrasound. That's what I did. Like juice or eat a piece of fruit. This can make them, move a little bit more. It can also be really stressful,
Right.
because, you don't want the ultrasound tech to find anything concerning. So some women, and even me, I had a little bit of anxiety about it, just laying there watching and looking at the ultrasound tech and her eyes like boring a hole in her. Tell me, tell me my baby's normal. But, really just try to enjoy it and don't read into the ultrasound tech's actions. If they're being
Right.
quiet, they might just be focusing on getting all of the correct images for the doctor to see. And if they
Right.
say at the end, I'm going to call the doctor, and don't freak out. Maybe they just want the doctor to say hi.
Right. Right.
Try
Yeah.
not to think of it in
Yeah.
that way. Try to be positive about it.
And I want to say this, ultrasound techs are really told that they are not the ones making the diagnosis. So they're not even allowed
Yeah.
to really tell you anything. They're
Yeah.
supposed to get all the right angles. And sometimes when they're concentrating on trying to get a specific angle right, they might have a stern look on their face, but that doesn't mean
Yeah.
there's anything wrong. And
No.
the doctors do not want them telling patients anything because they could be wrong.
Yeah.
So they're not allowed to tell you anything. So don't even bother asking them. They're not supposed to say anything. Okay, so
Good.
the other thing that happens in the second trimester is your gestational diabetes screening test. And this test is really going to be done between 24 and 28 weeks gestation, typically closer to 28 weeks if possible. And gestational diabetes is a specific type of diabetes that develops later in pregnancy. So, when you have gestational diabetes, that means you did not have diabetes before pregnancy. And the placenta actually produces a hormone called human placental lactogen that actually can make you more insulin resistant. And the
Yeah.
bigger the placenta gets, the more of that hormone is produced. So, the more insulin resistant you become. And that's why this develops later in pregnancy. So if you get tested early on, you'll test normal, but if you get tested later, you might test abnormal. So for this test, we have you drink a really sweet drink that has 50 grams of glucose. It's a very specific amount of sugar. And then we measure your blood sugar 60 minutes after you finish the drink. Despite what some people say, you do not need to fast before the test. You don't need to change your diet at all before the test. Now, I've had this test several times. It just tastes like extra sweet and really flat orange soda.
Yeah.
The orange one to me was the best flavor, but there are also other flavors available.
And, I've heard of some different options too, other than that glucose drink. One is called the fresh test. It's an option that's different than the glucola that works in order to do the gestational diabetes screening. I think you can order it online and
You
use it
can.
instead of the glucola drink that your doctor will have. It's a healthier alternative, has only 3 natural ingredients, no additives. So that's another option. But remember, this test is a screening test. It's not diagnostic, the 1 hour. So if your results are abnormal, then you just have to do another test to decide for sure if you have gestational diabetes. And so that's the 3 hour test. The 3 hour test is diagnostic. And for that one, you do have to be fasting. You drink something, and then we check your blood sugar at 1 hour after you drink, 2 hours, and then 3 hours. And if two of the three are abnormal, then it is a definitive test for gestational diabetes and you're actually diagnosed. Now, there are some instances if on the screening test your blood sugar is really high, then we don't even normally do the 3 hour test because it's so high, it just qualifies you as having gestational diabetes. But in general, it is a 2-step diagnostic process. I actually failed my 1 hour glucose test and I was devastated. I called mom devastated, crying. And then I had to go back and do the 3 hour test, and then I passed the 3 hour test. So I was not diagnosed with gestational diabetes. However, it did go in my chart that I had failed the 1 hour. So if you fail the 1 hour, it will be part of your chart saying that you failed it. There are a lot of opinions out there about the glucose testing. And I really want to say this, don't let their opinion scare you. I did not have a bad experience with the test. I thought the drinks tasted fine. They're just really sweet. I like soda anyways. It didn't taste that, but it tasted good. I agree. It tastes like flat orange soda.
Yeah.
I had the orange and then I had like the lemon lime one. Both were really good. I was able to drink it within that 5 minutes, no issues. I think I chugged it in 1 minute. um, I also did not feel sick really with either test. I've heard of it making some people really sick and nauseated, but I did not have that feeling. I did get very jittery after the 3 hour test. And thank God I had brought a granola bar with me and I ate it and then felt better. But that was really it. During the 3 hours, I was fine. I thought it was fine. So don't be nervous for it that you're going to be sick or it was going to be a horrible
Right.
experience because it wasn't for me.
Right. And also, if you fail one of the tests, either the 1 hour or the 3 hour, don't freak out. I also failed the 1 hour during my last pregnancy. I'd passed it with all the others. And if you're diagnosed with gestational diabetes, it's not the end of the world. There's nothing that you did wrong. It's caused by a hormone secreted by the placenta. And I have seen this in women who eat a very healthy diet, who exercise daily. They can still be diagnosed with gestational diabetes. So just continue with your healthy habits. Talk with your doctor about what else you need to do to control your blood sugar. Usually, you're just put on a diet and you check your blood sugars, and usually that's all you have to do. Some women will need help with insulin or other medications to keep their blood sugar under control. But don't freak out. It's not the end of the world, and it does not mean that you're going to have diabetes after the pregnancy is over.
Yeah.
The other test that we do between 13 and 28 weeks gestation is we repeat your blood count to see if you're anemic. So your complete blood count test. We want to definitely have that number up. So we check it again in the second trimester, that now that we're closer to delivery. And we have some time for you to take iron and get your blood count back up before delivery. You definitely don't want to go into your birth with a low blood count, because if you do, if you have issues with bleeding during your birth, that's going to make things worse. And if you're already starting out with a low blood count and then you have a lot of blood loss, you could be really exhausted afterward or even run the risk of needing a blood transfusion. So we check your blood count again at the third trimester to give some time to build it up prior to birth.
Perfect. Perfect. Okay, so let's finish up with the third trimester. There are a couple of tests that are done in the third trimester, and that is greater than 28 weeks. One is GBS, the Group B strep or Group B streptococcus.
Yeah, that bacteria, GBS, is a common bacteria found in 30 to 40% of pregnant women. And the bacteria does not cause any concern if you're not pregnant. It's a colonization, not an infection. However, when you do become pregnant, this bacteria could hurt your baby. And in rare circumstances, it could lead to preterm labor and cause problems for your baby. So, GBS in a baby can be pretty severe and even fatal. It does
Yeah.
not happen very commonly, but if it does happen, it can be dangerous.
Yeah.
In episode number 13, we really go in depth about GBS and why it's so important to test and get treated. Rachel actually was a newborn who had GBS sepsis after delivery and had to be
Yeah.
life flighted to an NICU for treatment. So listen to that episode if you haven't already. But I hope that you will get your GBS testing done in pregnancy.
Exactly. So we test for GBS between 35 and 37 weeks of pregnancy with a vaginal and rectal swab. And this is a swab that your doctor does for you, or sometimes they'll offer the option for you to do it yourself. I did mine on my own.
Yeah. And then the other thing that is recommended is that in the third trimester, we should repeat that syphilis screening again, because again, syphilis is on the rise in the US, and this is something that's completely preventable. So we recommend repeat syphilis screening in the third trimester, again, just to be sure. Along with that, we often repeat gonorrhea and chlamydia testing as well. Ultrasound in the third trimester is only done if there are issues, like if you have gestational diabetes, if you have high blood pressure, if there's a question about the baby's growth, if you have preterm labor. Any of those reasons and many other high risk moms will get extra ultrasounds done in the third trimester. But if you're normal and healthy, you may not get a third trimester ultrasound, and that's okay. You only need it if there are concerns.
Yeah, I mean, it could be a bummer to not get to see your baby again. But you only want to do stuff if it's needed. So okay, so that explains all of the prenatal tests that you can expect during your pregnancy. I mean,
Yeah,
that's a
that's a
lot.
lot.
Oh my gosh.
Yeah.
2 episodes worth. But all the tests are so important for your doctors to know how to treat you and how to treat your baby. If anything is missed, it can really be devastating to the baby. So make sure all of these tests are done. And again, check out episode number 13 if you have more questions about GBS screening and treatment and how it can impact your pregnancy and your baby, because it's very important.
Yeah.
Yeah.
Well, I think that's all we have for today. So thank you to everyone who joined us for this episode.
We really appreciate all of you guys listening so much. Please tell your friends and family members to listen if you know someone pregnant or someone who has a family member who's pregnant. And if you like our podcast, please give us a review. That really helps other people to find us.
And we'll be back next week with another episode. So see you all next
See you
time.
then. Bye.
Bye.